23, statement of fact number 23. Patient C's widow canceled $6,700 check. Dr. Buttar referred patient C account to a collection agency. The amount that Dr. Buttar sought from the patient's widow exceeded $25,000, which included the unpaid portion of patient C's bill, interest, and a 25% collection fee. I don't know what the details of this are. I don't get involved with this. This is actually our financial officer and the collection company that they deal with. So I don't know any of these details, but whatever it was, it's clearly stated in the financial policy that if somebody goes into collection, that there's going to be a collection fee, just like any other business would do. There's no difference in this. And there are doctors that do the same exact thing, but the medical board never gets involved with that type of situation, but they found it necessary to get involved with ours. Statement of fact number 24. Patient B was treated by Dr. Buttar for a period of 2 months, from April 2004 to June 2004. During this 2-month period, Dr. Buttar charged patient B in excess of $30,000 for ineffectual therapies. Once again, this ineffectual therapy that they're referring to is a CA-125 of over 10,000 that was dropped down to just a hair over 6,000 in less than 3 or 4 weeks of treatment. This is what they're referring to as ineffectual therapy. So if that's the idea of ineffectual therapies, then I would think that their effectual therapies would be curing stage 4 ovarian cancer with 10,000 CA-125 levels of over 10,000. Show me one case that conventionally has been treated with chemo and or radiation or whatever any other therapy that the medical board wants to show with a CA-125 of over 10,000 with the patient still alive. They are full of crap, and they know they're full of crap to make this kind of a statement. Yes, there was a charge for 30,000, but the patient didn't pay 30,000. Statement of fact 25. Prior to her death, patient B paid Dr. Buttar $10,258. Dr. Buttar has sought collection from patient B's estate the remaining $19,765 for the charges. So 2 months of treatment. You tell me 2 months of treatment every single day in a doctor's office for somewhere between 5 and 7 hours of therapy, and the patient only paid $10,258. The charges were over $30,000. That was money that she had paid. That was services that she had paid for, but she hadn't actually paid us yet. They had been charged. We had the cost of treatments administered, staff, etc., had been paid. Yes, we did seek that $19,765 back from the patient's estate, and it was that estate that we believe that the nephew was going to be getting some of that money, and that's why he filed a complaint to the medical board. Again, this is a business thing. The patient had services had been rendered to the patient. Patient had taken advantage of the services. The patient was fully aware of what the charges were. The patient asked for credit to be extended to her, which was extended to her, and the patient did not pay for more than 2/3 of the amount of charges that she paid for. So again, the medical board trying to say that I'm taking advantage of these patients. We've already discussed the first patient hadn't paid. They stopped payment on a check. This patient, of the $30,000, only paid $10,000. So again, where is it taking advantage of the financial situation of these patients? These patients didn't even pay for their bills, for God's sake, and the medical board's making a deal out of it. In fact, the prosecuting attorney said that I had to, his recommendation was that I would have to pay back the families for the charges. The families didn't even pay the full charges. So they're saying that the treatments that were given to the patient, they're saying because it was charged for $30,000 that I should pay the patient back $30,000, although the patient only paid $10,000. Again, the medical board is way off base. They're nothing but bullies. They're arrogant. They think that they're above the law. They've broken the law, and you've already been made aware of the law that they've broken. In any other type of case, when there's ex parte communication, the attorneys can be disbarred for this. Let's see what happens with the medical board attorneys on this particular case. And the people that are acting as my judge, jury, and executioner, they're not fit to be my judge, or jury, or my executioner. They have to be able to do what I'm doing, or they have to be at least able to understand what I'm doing before they can sit up there and on their high throne and make a judgment. There are doctors that were at that hearing that were appalled at what they heard, some of these so-called educated physicians, and what their statements were, how ignorant they were of how the human body works, how ignorant they were of simple things such as how important glutathione is, that it's a ubiquitous antioxidant in every cell in the body, primarily found in the hepatocyte. And somebody sitting up on that medical board throne makes a comment that, yes, I remember glutathione from biochemistry, but what relevance does it have in clinical medicine? For God's sake, if you don't know what the role of glutathione is in clinical medicine, you shouldn't be practicing medicine.